Hello. Hello students. So today we are going to discuss about the structure of optic head. Now what is optic head basically? Now optic head is the part of optic nerve which starts inside the eyeball. Now when you will have the retina, you know that retina is having the multiple layers. The innermost layer of retina is having the ganglionic cells. These ganglionic cells is going to form the axons. These axons are present deep to this internal limiting membrane of the retina, which separates it from the vitreous chamber. Now these axons are then converged at one point inside the eyeball. Now here, if you will cut the eyeball, you can see that on inner side is the retina and all the fibers are converging at one point. Now these fibers are come out from this point of the eyeball, and this point is known as initial point of the optic nerve, named as optic head. But the important thing is that this optic head is not present in the center on the posterior side. It is 4 to 5 mm medial to the center point from the posterior side. So by definition, what is optic head? Optic head is the part of optic nerve which is present within the eyeball. It is not visible on the outer surface. So it represents the point of exit or the point from which the optic nerve fiber leaves the eyeball. Clear? Now, when you will have the optic nerve head, what are the peculiarities of this optic nerve head? So let's discuss all the peculiarities one by one. Now, in the eyeball, the retina is having around 1 million ganglionic cells. So the number of axons present in the optic nerve are also 1 to 1.2 million. 1 to 1.2 million axons of the ganglionic cells are present in the optic nerve, which are converging on the optic head or optic disc. Clear? Now, this optic nerve head, as I already told you, is the part of eyeball or the bulb of eye. That means it is inside the eyeball, not visible from outside. The important thing is that at this point, all the neuronal elements are present. Absent. All the neuronal elements are absent. That means it is a blind point and it is insensitive to the light. So what is the your optic head? Optic head is the point inside the eyeball which allow the passage to the optic nerves to come out. So all the nerve converge at this point, and this point is not having any neuronal component of retina. That's why it is insensitive to the light. Now the surface view of the optic nerve head called optic disc, which is visible by the ophthalmoscope. So when you will examine the eye with the help of ophthalmoscope and you enter inside the eye, you are able to see a round area, and this round area is known as optic disc. This disc basically represents the optic head visible from the inside of eyeball. Clear? So this optic, what is optic head? Optic head defined as a area where the optic nerve fibers, that means the ganglionic cell axons, are converging and they are now going to leave the eyeball. So this zone of the optic nerve divided into the three parts: prelaminar zone, laminar zone, and post-laminar zone. Clear? Now let's discuss all these three zones one by one. So suppose we are having the three layers of your eyeball. So this is the outer layer. Now what is this outer layer? Outer layer is known as sclera. Now inside that you will have the second layer. Now inside the second layer, this is your choroid. Clear? And what is the innermost layer? The innermost layer is your retina. So we have these three layers of your eyeball. Okay. Now there is a gap. Now this gap is present between these layers, and this circular area is known as optic head. Now this optic head area divided further into the three zone. Now how we'll divide? Now inner two layer, that means the retina and the choroid, termed as prelaminar zone, the outer sclera termed as laminar zone, and then the adjacent part here is known as retrobulbar or post-laminar zone. Clear? Now, dear students, there is one more thing to understand, that what is here. Now this is the vitreous chamber. So you will have the membrane which is present here is known as internal limiting membrane. This internal limiting membrane separates your vitreous humor from the optic head. So this prelaminar zone anteriorly extend up to the this limiting membrane, and this limiting membrane separates it from the vitreous humor. Now the important thing comes is that when you will see the retina, if you will go to this first diagram which I just explained this, now these fibers of your ganglionic cells which are coming from this area are myelinated or unmyelinated. Answer is unmyelinated. So why they are unmyelinated? Because inside the eyeball you don't have the cells which are responsible for myelination. So when you will have the area which is known as prelaminar and laminar, that means till here you are inside the eyeball, and the fibers of the ganglionic cell when are passing through this area still remain unmyelinated. Clear? The myelination starts after the coming out from eyeball in the post-laminar area. Why it happens? Because oligodendrocytes are responsible for the myelination of the optic nerve fibers, and these are absent inside the eyeball. So when we are talking about pre and laminar zone, you don't have the myelinated nerve fibers, they are unmyelinated nerve fibers, and they are only supported by the astrocytes. Clear? So this should be very clear in your mind. Now, what is the difference between the pre and laminar zone? Laminar zone is having two characteristics. First thing is that in this area, you will have a cribriform plate in the sclera is known as lamina cribrosa. Now, through this lamina cribrosa, the fibers will come out in the form of bundles, small fasciculi, small groups. Now that is present into this lamina, but here in prelaminar zone the axons are not in the groups, and outside this laminar zone the fibers are having the myelination. So this should be very clear in your mind, that when you are reading the starting point of optic nerve, that is known as optic head. So optic head is further having three parts, but the most important question should be there in your mind, that the myelination is absent inside the eyeball. Myelination starts as soon as the fibers exit from the lamina cribrosa, because oligodendrocytes are absent inside the eyeball. Clear? So this is the important thing which you have to always keep in mind, that myelination is a feature of which zone? Answer is post-laminar zone. Now we'll move to the next important concept of the optic head. In the optic head, you will find that there are two important names related to the membrane. One is Astroglial membrane of Elschnig, and another is central meniscus of Kuhnt. Now, what these are basically? Now, again, when you will see the internal limiting membrane, this is the internal limiting membrane of the retina. Now, this is your center optic head. Now, in the center, what will happen? There is a thickening occurs, and this thickening is known as central meniscus of Kuhnt. And the continuation of this thickening with the remaining part of your internal limiting membrane is known as astroglial membrane of Elschnig. Now here in this diagram, you are able to understand this more clearly. Now here you can see that this is the area which is known as optic head, and it is a gap between the three layers. You will have the retina, choroid and sclera, retina, choroid and sclera, and this is the middle gap between this part. Now through this gap, the nerve fibers are converging and coming out outside. Now this gap is known as optic head. Now here you can see this is your internal limiting membrane. Now this internal limiting membrane is covering the optic head and going to the opposite side. But what you are able to see is that when you will see the center portion, in the center portion there is a large number of astrocyte cells are visible here, and this thickening of internal limiting membrane is known as central menisci of Kuhnt. And this central menisci of Kuhnt continue with the lateral part as a your astroglial membrane of Elschnig. So this is the important thing to understand, that astroglial membrane of Elschnig is present on the inner side and it continue with the internal limiting membrane of retina, and in the center it is continue with the menisci of Kuhnt, which is the thickest part of internal limiting membrane present on the center of optic disc. So it is why it is thickened, because of the large number of astrocyte cells. So that is the important concept about the two membranes present on the prelaminar region. Clear? Now we'll move to the next important concept. Now these three ends, now if I will draw again the three layer, this is the outer layer which is known as your sclera. Then inside that you will have the another layer. This is your choroid, and you will have one more layer inner side is your retina. Clear? Now if we have three layers and there is a gap is present between the three layers, which is known as optic head. Now what will happen, that dear students, you have to understand that this free margins of the retina are separated from the fibers which are present here. Then you will have again here the modification which is separating this second layer from this area, and in the same layer you will have one more layer. So these free margins of retina, choroid and sclera are supported and separated from this optic head by the modifications of your astroglial or astrocyte cells. Now these are known as supporting tissue. Now these are in the form of rings. So what is that? First is named as intermediary tissue of Kuhnt. Now this intermediary tissue of Kuhnt separates the optic nerve from the retina. That means this black is optic nerve and this is your area which is separating it from this optic nerve. So this is your retina and this is area of optic nerve, separated by this is known as intermediary tissue of Kuhnt. Now next to that you will have border tissue of Jacoby. So this red color is your choroid. Now this choroid is separated here by the tissue named as border tissue of Jacoby. So border tissue of Jacoby separates the optic head from the choroid. What is intermediary tissue of Kuhnt do? It separates the retina from the optic head. Now we'll move to the third layer, that is border tissue of Elschnig. Now this border tissue of Elschnig separates the optic head and nerve from the sclera plus choroid. So there is one more add-on. It is not only separating from the sclera but also from the choroid. So when you will see this image, now in this image, if we will draw all these three layers, if you will draw, where you will draw? On the sides, because they are separating this optic nerve head from these three layers. So how to draw? Now here you can draw, this is the first part, then this is the second part, and here is the third part. Clear? Now this first part is known as, what is this? This is your layer. Now what are the name? Intermediary tissue of Kuhnt. which is separating, this Kuhnt is separating the retina from the optic head. Then what is the second layer? Second layer is border tissue of Jacoby. So where is the border tissue? This is the border tissue of Jacoby separating the choroid from the head. Then what is the third layer? Border tissue of Elschnig. So this is the border tissue of Elschnig separating the choroid and sclera both from the optic nerve. Clear? So dear students, whenever you are reading the optic nerve head, these 5 names are there. What are these 5 names? Again, I will revise. The first name is Astroglial membrane of Elschnig. What is that? It is a modification of internal limiting membrane as it is approaching towards the optic head. What is the central meniscus of Kuhnt? It is the most thickest part of the internal limiting membrane in the center. And this center portion is thickest because it is having the highest number of astrocytes. So these both are actually modification of internal limiting membrane of retina. And how the 3 layers of the eyeball remain separated from this canal, or you can say the optic head, or from the optic nerve. So from in to out, the retina is separated from the optic nerve. The retina is separated from the optic nerve by the intermediary tissue of Kuhnt. Then choroid remains separated from the optic nerve by the border tissue of Jacoby, and sclera and choroid both are remain separated from the optic nerve by the border tissue of Elschnig. Clear? So I hope now this is very clear to all of you. So now we'll move to the after prelaminar, you will have laminar zone and post-laminar zone. Now here you have to keep this thing in mind that I just told you what is the difference between all the 3 zones, that as you will enter into the laminar zone, the retinal ganglionic axon enter into the optic nerve head accompanied by the astrocytes. Now the number of astrocytes are increasing. If you will come from prelaminar to laminar to post-laminar, the number of astrocyte cells are continuously increasing as the nerves are exiting from the eyeball. Now, when you will go into the laminar zone, the nerve fibers already divided into the fasciculi. They are divided into the fasciculi, and these fasciculi are going to exit from the cribrosa. But when you will enter into the post-laminar zone, which is outside the eyeball, the most characteristic feature is there is a start of myelination because the oligodendrocytes are present outside the eyeball. They are absent inside the eyeball. Clear? So, dear students, you may have some important MCQs from this topic. For example, at the center of optic disc, the astrocytes thicken to form which of the following structure? So, I just told you which is the thickest structure. Answer is central menisci of the Kuhnt. The second question is that which structure separates the optic nerve head from the choroid? So, that is your border tissue of Jacoby, which separated from the choroid. So, dear students, by the end of this session, we should be able to understand that when we are having the optic nerve, it starts from the optic head. This optic head is the point where all axons of the ganglionic cell converge and they start to come out from the eyeball. The initial fibers of the ganglionic cells are unmyelinated. The optic head is a blind point because this is a circular area which is devoid of any kind of neuronal cells. So because neuronal cells are not there, the vision is not there, it is insensitive for the light. And the important thing is that the myelination starts only into the retrobulbar or post or retrolaminar area because oligodendrocytes are not present inside the eyeball layers. So this is all for the session. Thank you and bye-bye.